Cancer is the second leading cause of death in the world. Cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. The skin is the body's largest organ. Skin cancer is the abnormal growth of skin cells which most often develops on skin exposed to the sun, tanning beds, or sun lamps. The exposed areas generally include scalp, face, lips, ears, neck, chest, arms and hands, and legs. But this common form of cancer can also occur on areas of your skin not ordinarily exposed to sunlight, such as on palms, beneath your fingernails or toenails, and your genital area. Basal and squamous cell carcinomas are the two most common types of skin cancer. Melanoma, the third most common type of skin cancer, begins in the melanocytes. Of all types of skin cancer, melanoma causes the most deaths because of its tendency to spread to other parts of the body, including vital organs. Basal cell carcinoma usually occurs in sun-exposed areas of your body, such as your neck or face. Basal cell carcinoma may appear as a pearly or waxy bump, a flat, flesh-colored or brown scar-like lesion, a bleeding or scabbing sore that heals and returns. Usually, squamous cell carcinoma occurs on sun-exposed areas of your body, such as your face, ears, and hands. People with darker skin are more likely to develop squamous cell carcinoma on areas that aren't often exposed to the sun. Squamous cell carcinoma may appear as a firm, red nodule, a flat lesion with a scaly, crusted surface. Melanoma can develop anywhere on your body, in otherwise normal skin or in an existing mole that becomes cancerous. Melanoma most often appears on the face or the trunk of affected men. In women, this type of cancer most often develops on the lower legs. In both men and women, melanoma can occur on skin that hasn't been exposed to the sun. Melanoma can affect people of any skin tone. In people with darker skin tones, melanoma tends to occur on the palms or soles, or under the fingernails or toenails. Melanoma signs include a large brownish spot with darker speckles, a mole that changes in color, size, or feel, or that bleeds, a small lesion with an irregular border and portions that appear red, pink, white, blue, or blue-black, a painful lesion that itches or burns. Skin cancer risk factors include fair skin. Anyone, irrespective of skin color, can get skin cancer. However, having less pigment in your skin provides less safety from damaging UV radiation. If you have blonde or red hair and light-colored eyes, and you freckle or sunburn easily, you're much more likely to develop skin cancer than is a person having darker skin. A history of sunburns. Having blistering sunburns as a child or teenager increases your risk of developing skin cancer as an adult. Excessive sun exposure. Anyone who spends considerable time in the sun may develop skin cancer, especially if the skin isn't protected by sunscreen or clothing. Tanning, including exposure to tanning lamps and beds, also puts you at risk. A tan is your skin's injury response to excessive UV radiation. Sunny or high-altitude climates. People who live in sunny, warm climates are exposed to more sunlight than are people who live in colder climates. Living at higher elevations, where the sunlight is strongest, also exposes you to more radiation. Moles. People who have many moles or abnormal moles are at increased risk of skin cancer. These abnormal moles, which look irregular and are generally larger than normal moles, are more likely than others to become cancerous. If you have a history of abnormal moles, watch them regularly for changes. Precancerous skin lesions. Having skin lesions can increase your risk of developing skin cancer. These precancerous skin growths typically appear as rough, scaly patches that range in color from brown to dark pink. They're most common on the face, head, and hands of fair-skinned people whose skin has been sun-damaged. A family history of skin cancer. If one of your parents or a sibling has had skin cancer, you may have an increased risk of the disease. A personal history of skin cancer. If you developed skin cancer once, you're at risk of developing it again. A weakened immune system. People with weakened immune systems have a greater risk of developing skin cancer. This includes people living with HIV, AIDS, and those taking immunosuppressant drugs after an organ transplant. Exposure to radiation. People who received radiation treatment for skin conditions such as eczema and acne may have an increased risk of skin cancer, particularly basal cell carcinoma. Exposure to certain substances. Exposure to certain substances, such as arsenic, may increase your risk of skin cancer. Skin cancer diagnosis can be performed in the following ways. Skin examination. Your doctor may look at your skin to determine whether your skin changes are likely to be skin cancer. Further testing may be needed to confirm that diagnosis. Skin biopsy. Your doctor may remove the suspicious-looking skin for lab testing. A biopsy can determine whether you have skin cancer and, if so, what type of skin cancer you have. If your doctor determines you have skin cancer, you may have additional tests to determine the stage of the skin cancer. The skin cancer stage helps determine which treatment options will be most effective. The treatment options for skin cancer depend on the size, type, depth, and location of the lesions. Small skin cancers limited to the surface of the skin may not require treatment beyond an initial skin biopsy. That removes the entire growth. Additional treatment options include cryosurgery. Your doctor may destroy actinic keratosis and some small, early skin cancers by freezing them with liquid nitrogen. The dead tissue sloughs off when it thaws. Excisional surgery. This type of treatment may be appropriate for any type of skin cancer. Your doctor cuts out, excises, the cancerous tissue and a surrounding margin of healthy skin. A wide excision, removing extra normal skin around the tumor, may be recommended in some cases. Mohs surgery. During Mohs surgery, your doctor removes the skin growth layer by layer, examining each layer under the microscope, until no abnormal cells remain. This procedure applies to larger, recurring or difficult-to-treat skin cancers, which may include both basal and squamous cell carcinomas. It's often used in areas where it's necessary to conserve as much skin as possible, such as on the nose. These simple, quick procedures may be used to treat basal cell cancers or thin squamous cell cancers. Radiation therapy. Radiation therapy uses high-powered energy beams, such as X-rays, to kill cancer cells. Radiation therapy may be an option when cancer can't be completely removed during surgery. Chemotherapy. In chemotherapy, drugs are used to kill cancer cells. For cancers limited to the top layer of skin, Creams or lotions containing anti-cancer agents may be applied directly to the skin. Systemic chemotherapy can be used to treat skin cancers that have spread to other parts of the body. Photodynamic therapy. This treatment destroys skin cancer cells with a combination of laser light and drugs that makes cancer cells sensitive to light. Biological therapy. Biological therapy uses your body's immune system to kill cancer cells. Most skin cancers are preventable. To protect yourself, follow these skin cancer prevention suggestions. Avoid the sun during the middle of the day. The sun's rays are strongest between about 10 a.m. and 4 p.m. for many regions. Schedule outdoor activities for other times of the day, even in winter or when the sky is cloudy. You absorb UV radiation year-round, and clouds offer little protection from damaging rays. Avoiding the sun at its strongest helps you avoid the sunburns and suntans that cause skin damage, and increase your risk of developing skin cancer. Sun exposure accumulated over time also may cause skin cancer. Wear sunscreen year-round. Sunscreens don't filter out all harmful UV radiation, especially the radiation that can lead to melanoma. But they play a major role in an overall sun protection program. Use a broad-spectrum sunscreen with an SPF of at least 30, even on cloudy days. Apply sunscreen generously and reapply every 2 hours, or more often if you're swimming or perspiring. Use a generous amount of sunscreen on all exposed skin, including your lips, the tips of your ears, and the backs of your hands and neck. Wear protective clothing. Sunscreens don't provide complete protection from UV rays. So cover your skin with dark, tightly woven clothing that covers your arms and legs, and a broad-brimmed hat, which provides more protection than a baseball cap or visor does. Some companies also sell photoprotective clothing. A dermatologist can recommend an appropriate brand. Don't forget sunglasses. Look for those that block both types of UV radiation, UVA and UVB rays. Avoid tanning beds. Lights used in tanning beds emit UV rays and can increase your risk of skin cancer. Be aware of sun-sensitizing medications. Some common prescription and over-the-counter drugs, including antibiotics, can make your skin more sensitive to sunlight. Ask your doctor or pharmacist about the side effects of any medications you take. If they increase your sensitivity to sunlight, take extra precautions to stay out of the sun in order to protect your skin. Check your skin regularly and report changes to your doctor. Examine your skin often for new skin growths or changes in existing moles, freckles, bumps, and birthmarks.